If you have been recommended to have a mastectomy as part of your cancer treatment, you have options. You may decide to go flat and not have any reconstruction at all, and that's absolutely fine. You do not need to have a reconstruction if you do not want to. However, if you do want a reconstruction, then this is the video for you. Hi, my name is Dr. Tasha and I'm a breast surgeon. So, what are your reconstructive options? First of all, you can decide when you would like to have it. You can either have it as an immediate reconstruction or as a delayed reconstruction. An immediate reconstruction basically means you'll have the reconstruction at the same time as your mastectomy. So what will happen is the mastectomy will be performed, the breast will be removed, and then a reconstruction is performed. So when you wake up, you will not be flat and you will have what we call a mound or a shape to the breast. Or you can have it as a delayed reconstruction. That means that you will go flat first, so the mastectomy will be done. You will then have any other treatment that you may need, for example, chemotherapy or even radiotherapy. And then at a later stage, you can decide to have the reconstruction. Some women may decide to have a delayed reconstruction because it's a lot to think about. You may want to just treat it first and then think about a reconstruction later on. So, what are your reconstructive options? Well, broadly speaking, there are two types of reconstructions you can have. You can either have an implant-based reconstruction or using your own body tissue, which is also called an autologous-based reconstruction. Let's talk about the implant-based reconstruction first. An implant-based reconstruction uses an implant, and you can have two types. You can either have what's called a direct-to-implant reconstruction, where we use the permanent implant straight away, or you can also have what's called an expander-implant reconstruction. So that's a two-stage type of implant-based reconstruction. The expander will be placed and then you will come to clinic every 2 weeks. We will then inflate the expander to a size that you're happy with, and then at the second operation we'll remove it and replace it with a permanent implant. You will have one scar which is on the breast, and recovery time is pretty swift. You will, though, need what's called maintenance surgery because an implant will not last forever. The implant may rupture, move around, and it can also develop what's called a capsular contracture, which is a firm shell overlying the implant, which can be a little bit uncomfortable. Now let's talk about the autologous-based reconstruction, which is using your own body tissue. And you also have options in this type of reconstruction. You can either use your LD muscle, which is your latissimus dorsi muscle, the muscle just over your scapula, and you'll have two scars, one on the back and one on the breast. The operation is a bit longer than an implant-based reconstruction, and the recovery time is also a bit longer. You can also use a DIEP flap, which is this bit on your tummy that you can grab if you have any tummy at all. What will happen is the skin and the fat from the tummy is detached from your person and then reattached onto your chest wall, because obviously the breast would have been removed by that stage. And then it's plumbed or connected to blood vessels either on your chest wall or your armpit. You'll have two scars, one on the breast and a long scar along the bottom half of your tummy. It's a bit like a cesarean scar if you've had a cesarean section, but it's much, much longer. It's from one side to the next. Your belly button will move up a little bit and your tummy will be flat. The surgery time is a bit longer. It can take up to 5 hours plus. And the recovery time is also a bit longer. It may take up to 3 months to be 100% back to your normal self. But you don't need what's called maintenance surgery if it works. And in some centers, less than 5%, even less, fail. So the majority of them work. And if it works, then that's it. You do not need any form of surgery going forward, unlike an implant-based reconstruction. Another type of reconstruction, which is using your own body tissue, is what's called a TUG flap, which is the part of the inner thighs, so the bits that you can grab again if you have any tissue there. And you'll have the scar along the inner thigh as well. So you have options. If you decide to have autologous-based reconstruction, these procedures are usually done jointly with plastic surgeons. How do you decide what type of reconstruction is best for you? There are so many factors that come into play that may mean that one type of reconstruction is better over the other. And this is a discussion that we can have in a later video, but in the meantime, take care and I'll see you in the next one.